Welcome to our series on how government agencies are accelerating innovation with data and analytics. I'm Wyatt Cash with Scoop News Group, and we're here today with Jeff Shilling, Chief Information Officer at the National Cancer Institute at the National Institutes of Health. Jeff, thank you so much for joining us.
Great to be here, Wyatt.
So let me start by asking, what makes a data-led migration to the cloud? That is, where agencies can migrate and analyze data in the cloud. What makes that different from migrating whole applications or other workloads to the cloud?
Well, I would say it pretty much goes the way you described it. You traditionally would move a system to the cloud, and that system would contain capability, an analysis or data entry component, and it would contain a data component. But at the National Cancer Institute, we had a unique situation where we had a lot of data, some very standardized data that was developed. For example, the Cancer Genome Atlas. It's basically a set of very standardized data that could be used by other researchers. So it's very mission driven, but I think it's very similar to how a lot of groups who would do any kind of data analysis, they would have their own sets of standardized data. And we fund a lot of researchers. So we were struggling with how do we get this large multi-petabyte data set to all these researchers? And we created a set of have and haves nots. The small research institutes couldn't get the data, and the large research institutes could, and they were at an advantage. So we created we call it the cloud pilots at the time, and now it's called the cloud resources. But we moved all that data into the cloud, into several different clouds, created a structure around it, mainly around data curation and data standardization, and then created a set of very basic tools so researchers could come in, bring their data in, and analyze their data against those standardized data sets. So I think that really fits in kind of what you were saying, rather than think about how we function as a FISMA model where we have systems. We basically kind of broke with that because we didn't really have any universal system that we wanted people to use. We had kind of universal data.
I get that. Well, next, how has the ability to migrate and analyze data in the cloud actually helped improve decision-making internally at your organization?
I think what the first thing that comes to mind is right away, the recommendations were, we want more of this. So the ability, the first data we put in there was genomics data. So it's very important for cancer research to be able to analyze a tumor's genome or even single cell genomes against kind of these standards. And so, but right away, the researchers came back and they basically said, we need other standards. So we need imaging data, we need pathology data. So I think right away that said, okay, it's a success because people are generating publications from this. So the metrics that we use for success, as well as, of course, we track long-term cancer health and cancer survivorship and cancer incidence. You know, we ideally don't want anybody to get cancer, much less have to cure them, right? So prevention is a big piece. And then we also started measuring who was getting access to these data sets. And we saw that was growing and growing. And the thing that I mentioned, the haves versus have-nots, we were able to change the granting process a little bit so that people could compete on a more even playing field. You didn't have to be at a big university or cancer center. You just had to be innovative, and then you could get access to those data sets. So I will say, though, if we were to say how it really changed, it really moved us into the mindset of being more digital. Healthcare is not really always digital, right? The doctor palpates something, they feel something, maybe they take your temperature, that's digital. They measure your weight, that's digital. But a lot of things are done visually. And so the idea is that we can start to describe cancer in a digital way. That's, I would say, is the big breakthrough that's really going on and is going to be going on for 50 years, I'm sure.
Really interesting. Well, next, let me shift gears a little and ask, how did working with a leading cloud provider and also this community of cloud partners speed up the quote unquote time to value in improving constituent services?
It's so large, it's hard to describe, I would say. I mean, the ability to have infrastructure that you can count on, that's cost effective, that has very knowledgeable staff running it, and a whole cadre of people you can consult with on how to implement in it. It's hard to describe to the people who really don't work in the cloud how much of a change it is. And I'm not saying that because of the idea of the cloud, but the cloud vendors have done such a fantastic job in producing a product that's nearly flawless, right? If something goes down, it's like Netflix was down for 5 minutes. The web was down for whatever, email was down for an hour. That used to happen every month when stuff was on-prem. Now it's newsworthy event around the country when something like this happens. And so the other thing I think is that they're so innovative. They're constantly driving innovation. I sometimes will say we're in the golden age of the cloud, because right now we have just the right mixture of innovation, competition. Nobody's won yet, right? I mean, we have the big players, but still there's a lot of competition, and there's so many new things happening all the time. Every time there's a problem, it gets solved. And so I would say the only problems we have are just keeping up with it. It's very, very, it's very dynamic, and getting staff in who actually know enough about it to actually create something that's cutting edge. But those are great problems to have, right? Those are problems that you want to have. And I will say, I have tried to communicate this to people, but I just say, it's amazing. You could take it for granted that all this just works. You can literally say, Jeff, I'm going to have this meeting with you at 3:30, and poof, it just happens. We don't even have a contingency plan, nothing. We just have a 3:30, a half-hour window to do this conversation. Yet we have such great experience in this happening at a very reliable level that we just say, hey, this is good to go. It is a big thing to bank a lot of our resources on. We can say that we took for granted the supply chain. And now with the supply chain, all of a sudden a little out of kilter, like all of a sudden manufacturing, everybody's waiting for goods. So those kinds of things, I think the cloud providers have really thought through really, really well.
Great point. And then maybe lastly, how have efforts in migrating and analyzing data in the cloud changed your organization's overall cloud strategy and priorities?
Well, I would say, we now have adopted a cloud first model. So we really look at every idea that comes in, every new request for services. They can be just administrative processes, how we run the institute, the granting process. All of that is done now with a cloud first mentality. It's a shakeup because you have a lot of people who have a lot of capabilities for how we previously did work. And sometimes it's hard to explain why the additional difficulty of doing something in a cloud first model, because we can't always roll it out as quickly, even though you might think that, well, the cloud is faster, it's virtual, it's like, right, but all that has to be configured. And in the on-premise model, a lot of stuff is already pre-configured and ready to go. It's just not very flexible. And so the thing though, what we're really trying to do is we're really trying to get away from being an organization, in my IT organization. We don't want to be an organization that works with technology. We want to be an organization that works on the mission. And so the more we can give that technology work to the cloud providers, the more all of our staff can understand the mission. They can understand our executive officer needs to improve how our acquisitions are done. Our HR staff need to hire more people, need to do more predictive analytics. Who really do we think is going to be retiring? And how do we prepare for that? If my staff are configuring servers or, building storage arrays or troubleshooting all that stuff, they don't have the time to work in the mission space. And so to me, that's our real mantra. We want our staff working in the mission space, not in the tech space. And because we can buy the tech space, right? I can't buy the staff who know the mission because it takes a long time to understand that. So I would say it's been our thrust for the last few years, but it really is a long-term, probably a 10-year change in how we do the work, how we get even the staff to think about, not just my staff, but even the scientific staff and the administrative staff to think about how we do things. The only thing I would say that's the downside to this effort is there's so many cloud tools. We have to have much more governance around, this is the tool set we're using. Yes, I know there's a million other great tools out there, and I know those other tools are good, but we can't be successful if we have too many solutions to the same problems. We really want to kind of limit that. And that's maybe something new for us too.
Well, Jeff Shilling, thank you so much for taking a few minutes to share your insights with us about accelerating innovation with data and analytics.
It was my pleasure to be here. Thank you.